Dr. Evan Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Simply Avante. Always forward. Overall, the hip is improving.
Yes.
Which hip is it, left or right?
Right.
And what motions hurt the most?
Getting up from driving home.
Gotcha. And if you try to cross your right leg over your left leg, does that hurt you at all?
Doesn't hurt. It's not easy.
And now switch legs? No problem. Now, if you bring your knees together and touch my hands, now separate your feet. So keep knees contact. Does that hurt at all? Nope. Okay, now from here, turn your leg this way. So you can bring your leg up and turn it out on that side. Good. And then compare it to this side.
Everything's just easier.
Easier on this side. Okay. So what we're going to do is this. We're going to use the left leg to rehab the right leg. So there's a reflex that occurs called the pontomedullary reticular formation. When we rehab the opposite side, it actually helps rehab the affected side. So what I want you to do from here, you're just going to do this. And you're going to go outwards, just on this side. And we're going to do that. We're going to do that 10 times. 9. And the last one, hold it as long as you can. Hold it, hold it, hold it, hold it. Bring it out, 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 bring it out. And you see it's compensating. That's okay. That's fine. Keep on going, 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 keep on going. And relax. Now do me a favor. Try this leg again. Same motion. I'm sorry, not that motion. The same motion you were just doing, outwards on that side. Does that feel like it got a little bit easier for you? No, it feels the same? Now, bring your knees together and then bring your both legs out. How's that feel? Feels okay? Does it feel different than it did before?
No.
No, okay. We'll do another set of that. So we just keep on doing this until it creates a change into this hip. Good. Now, try that side. Now bring the knees together and try it again. Good. How'd that feel? A little bit different? Looks like it actually increased the range of motion. So I want you to do another set of 10. So this is something you can do at home. Where you find a motion, if it's a shoulder issue, compare it to the other side, and then just work the opposite side, opposite from where your pain pattern is. Very simple to do, 3 sets of 10 at home. Good.